everybody can hear me okay. So it's noon, and I was thinking, what am I supposed to say at noon? Is it afternoon or is it morning? And what do I say? But I'll just say good afternoon, everybody, and welcome to the October meeting of the Kansas COVID Vaccine Equity Task Force. Really nice to see all of you. And my name is Jimena Garcia, and I know all of you now, I think. I'm Governor Kelly's Senior Advisor for COVID-19 Vaccine Equity. And as always, I have a few housekeeping items to share. So, oops. Thank you for putting up the agenda. So COVID operates in compliance with the Kansas Open Meetings Act. The meeting is being recorded and broadcast live for public viewing on Governor Kelly's YouTube channel, which we provided the link for prior to today's meeting.
I will not have a lot to say.
Okay.
We ask that you please mute yourselves when not speaking to prevent audio interference. And also, please state your name and title prior to speaking. So I would like to go through a quick roll call. So just say here. I'll start at the top. Annette Graham.
Here.
Martha Gabehart.
Here.
Stacy Knoll. David Jordan. Michelle Ponce. Kelly Summers.
Here.
Jonella Holmes.
Here.
John Carney. Rachel Monger. Sarah Landry.
Here.
Sarah Obermeyer.
Here.
Jean Luger. Tara Nolan. Lashika Williams.
Had kind of a pre-meeting.
Charla Smith.
Here.
Mariana Ramirez. Nicole Garner.
Here.
Virgil Watson.
Here.
Edith Gaines. Christina Simmons. Mang Sana.
Here.
Tara Remington Brown. Erica Andrade. Connie Satzler.
Here.
Elaine Johannes. Broderick Crawford. I don't know if I'm Ms. Poindexter. I don't want to mispronounce your name. Dashinika.
Here, yes, Dashanika Poindexter. Thank you.
Dashinika. Thank you for pronouncing it. Shannon Olson. Glenda Dubois. Kimberly Scott.
Here.
Alice Weingartner. And Danielle Norwood. Okay, so I'm just going to quickly go through the agenda and then we can get started. So I'm going to begin with the usual update on where we stand with COVID vaccinations in Kansas. Then we're going to move to the main presentations and the discussions, which today are focusing around understanding and addressing the roots of inequities. We're going to hear from Dr. Jonella Holmes, the Executive Director of the Kansas Black Farmers Association, and also Dr. Charla Smith, Associate Professor in the Department of Population Health and Director of the Birth Equity in the Department of OBGYN at KUMC. And then after the presentations, we're going to do it a little bit differently. We're going to have 4 breakout groups, but each group is going to be focusing on a different topic, a different aspect of the inequities that exist, especially around the COVID vaccine. And it's my hope that the ideas generated in the discussions today can be catalysts for action that can be funded by the pandemic assistance grants for vaccine equity or PAVE, because these are available to anyone in this group and to people in your networks and communities to promote vaccination in people of color in Kansas. And the applications are open now, being accepted through the end of the year, and the funds can be used through the end of 2023. And the funding is up to $10,000. So that's our agenda. Next slide, please. My vaccine update. Okay, here we go. So currently we have 64% of adults fully vaccinated in Kansas and about 75% with 1 dose. We have 62% of the eligible population, or people age 12 and older that are fully vaccinated, and about 72% with a single dose. And in terms of the total population, we have 52% of the total population has been fully vaccinated, and 61% have had one dose. Next slide, please. So here are the numbers of adults vaccinated, broken down by race and ethnicity. And we see that Black vaccination continues to lag about 8 points behind white vaccination, and Asian and Latino vaccination rates are ahead of white and non-Latino vaccination rates. Next slide, please. Here is youth vaccination broken down by race and ethnicity. Here, the gaps are much smaller. There's a 2-point difference between white and Black youth vaccination, 12% versus 10%. Asian youth are higher at 20%, and Latino and non-Latina are pretty close at about 15%. And I want to just make a comment that we are keenly aware that we need to do better for African American and Black Kansans in terms of vaccinations. And it's an effort we're really doubling down on in terms of having more specific and focused media efforts, as well as a plan for canvassing. And we hope, as I mentioned, that with the PAVE funding available, community groups who are interested in this work can have the resources to help us reach Black and African American Kansas communities. So with that, I'm going to hand the floor to our wonderful facilitator, Dr. Vicki Collins-Akers, so she can introduce our speakers today and we can get started.
All right, thank you. Good afternoon, everyone. I'm excited to have the opportunity to introduce our two speakers for this afternoon. Both of our speakers are going to speak to their work around COVID and vaccination and broader work around equity. As always, we have the full bios for our speakers in the slide deck that will be shared out. So I'm going to read an abridged version, and I will just say that Dr. Holmes and Charlotte and Dr. Smith both have some very interesting backgrounds. So I hope you will take time to read their full background, because I don't think I will do them justice by this abridged version. So with that, I'd like to start by introducing Dr. Holmes, and then I'll introduce Dr. Smith and hand it over to Dr. Holmes for her presentation. Dr. Jonella Holmes is a proud alumnus of Fort Hays State University and Kansas State University. She developed and implemented a very successful and widely recognized multicultural student advising and retention program at K-State, which was aimed at increasing retention of multicultural students on academic probation. She describes herself as blessed to live in historic Nicodemus, the oldest African-American town west of the Mississippi River and a National Historic Site. And is a fifth generation descendant of the original settlers. She has done considerable work in Nicodemus and throughout Kansas, including co-creating the Nicodemus Educational Camps for Youth, where they expose inner city youth to agriculture at K-State and in historic Nicodemus. And she also developed and received funding for a project to build tiny homes for low-income, elderly, or veterans as part of their effort to increase the town's population through homesteading. She also serves so many hats. She also serves as the executive director of the Kansas Black Farmers Association, which was awarded a grant to work on COVID vaccine awareness, and she'll be describing some of that work today. After Dr. Holmes' presentation, Dr. Charlotte Smith will be presenting. Dr. Smith is an associate professor in the Department of Population Health and the director of the Birth Equity Network in the Department of Obstetrics and Gynecology at the University of Kansas School of Medicine, Kansas City. Dr. Smith has a PhD in health systems and services research with a concentration in health economics, and she earned her undergraduate degree in biology from the University of Arkansas at Pine Bluff, a master's of public health degree in health policy and management from the University of Arkansas Medical Sciences, and a PhD in health services and systems research at UAMS. She is a health services and systems researcher that has been working in public health since 2006. Her current research focuses on maternal and infant health disparities, health equity, and community engagement. We're very excited to have them both here today. With that, I will hand it over to Dr. Holmes for her presentation.
Good afternoon. One of my best and most proud moments I had a chance to relive as we opened up this morning, and that was seeing Reverend Tony pastor, Reverend Tony Carter. He baptized my boys. He came all the way to Nicodemus, Kansas, and baptized both of my boys, and kept me sane through that whole process. And then my daughter chose him to in his church to marry. So we have a long and a wonderful history. I am the executive director of the Kansas Black Farmers Association. One of the few women, Black women across the United States that is really at the head of these organizations and trying to move forward with our Black farmers and recognize the inequities that are around and how do we solve those and how do we move forward. Next slide. Yeah, there we go. I wanted to give you just a quick foundation. Nicodemus in 1996 was signed in by Congress and President then Clinton as a National Historic Site. We are the oldest African-American settlement from the Reconstruction period that's still in existence west of the Mississippi River. So we have a lot of pride and a lot of history. In 2015, I was able to take early retirement and move back home to do some different things that I needed to do. And so one of them was really putting boots on the ground and working with the Kansas Black Farmers Association. These two men are the ones that started the organization in 1999. It really came about as they were fighting with and had joined the group to fight the case Pickford versus Glickman. And that's where Black farmers were discriminated against in their loan and other programs. And so that's what brought our farmers together. At that time, they had 58 African-American farmers that were there starting the organization. We are now down to 6. So we are really struggling. We are really doing some things to hold on to land loss and also create new farmers, beginning farmers, and let women also recognize that they're farmers and how that all comes about. Next slide. We want to preserve Black land ownership. We've really been fighting with that across the nation. There's other things that are going on. One of our missions were to promote and fortify the Nicodemus farming legacy, but also to develop a youth education program. We're extremely proud of this program. We served our 600th youth in 2019. And we bring those inner city kids, they don't pay a dime. We raise all the money for them to come out and attend this week-long residential camp. We start at K-State, where they get to work with professors, where they get to see students that look like them, that are majoring in agronomy and pre-vet and all of those wonderful majors. At K-State, they get to realize how agriculture touches every aspect of their lives. And so we've been growing and developing some great future farmers. Next slide. You could go out on our website and you'd be able to see a wonderful video clip that was produced by the public broadcasting system. And how they come out there and how it changes their lives and how they get to see, go to the dairy barn and they just love all of that. And our camp, that specific camp was named after Verl Schweitzer, who was recognized this weekend as one of the legacies at Kansas State. He was one of their first scholarship athletes. He was the first to integrate the NFL in Green Bay Packers, rather. And in 1954, he was the number 4 draft pick during the NFL draft. So we're very proud of Verl. He came back to K-State and started the student athletic program and the trio programs. And so our camp actually kind of mirrors that of the Upward Bound programs. Next slide. Okay, so how did we get involved in all of this? And that was by simply asking a question, how can the state of Kansas help? And then I was introduced to Dr. Garcia and Stacy Knowles. And I was just like, oh my goodness, you guys are doing it, you get it. And so in the meantime, we were creating strategies because we had received a grant through Alianza Campesina and also the Rural Coalition out of DC. We looked at what our strategies, what our population was doing. How do we work with them? They put us in connection with the Migrant Clinician Network. That's what MCN stands for. And they helped us produce brochures. They helped us put together flyers. They helped us do it in both language. So it's also in English and in Spanish. They helped us develop a rapid community assessment so that we wouldn't kind of be spending resources or our times in areas that have high levels of vaccination, or we're missing our ethnic minority populations. We wanted to concentrate on those areas. And so that also put us in contact with Pastor Carter. We worked an event for him. We're going to be working other events with him and that sort of thing, putting people that are actually volunteering and working, bringing in nurses and other staff that can also help with the vaccine and the testing. We had to also learn how to do some de-escalation and how to protect our staff. We have received some resistance, and especially out in Western Kansas. It just breaks my heart. We want to provide our mobile unit, which we're trying to put together right now with the help of the state of Kansas and the grant, and provide it at one of the events in my county, Graham County, in November. And we were told no. We tried to provide this information for our high school students and their parents. And we were told no, our county is not doing anything to encourage the vaccination. And that just simply breaks my heart, because then the word is not getting out to people, the correct information isn't. And so that's why we did that. Some of the partners, of course, is Governor Kelly's office, the lieutenant governors. We met with him and discussed this with the Rural Initiative. Kansas Beat the Virus team, we were successful in obtaining 2 of the $2,000 grants to do our programs. We've established a relationship with the Potawatomi Tribal Nation, Wichita Black Nurses Association, and with Core Laboratories. Next slide. When we applied for the grant as a subcontractor to Rural Coalition, we wanted to target and make sure that our BIPOC, Black, Indigenous, people of color farmers were getting the information. And so that's why I have the map up there. But we also chose to cover the entire state because we are the Kansas Black Farmers Association. We do have farmers that are in the southeast part of the state. We do have them in the northeast part of the state, as well as the west side and south. And so we wanted to be able to cover the entire state. It's been daunting, but it's doable. And we've divided into chunks, and we can talk about that at a later date. We've recalibrated our goals, and now we are looking at areas which include meat packing plants. Garden City has just been a blessing to us because not only are they printing off our flyers and we don't have that expense, they're making sure that it's sent to the Human Relations Department and that the information is provided not only bilingual, but in 4 different languages, to make sure that it's covering that population. So Garden City is really doing a great job in helping us. We have also started to include the MCM's Vaccination Is, and we've also program, and that is to encourage the 3rd dose. They don't want us to call it a booster. They want us to call it a 3rd dose. So we're doing that. One of the things the state of Kansas is helping us on is we thought we needed to get a mobile unit. When we did our assessment, just really quickly, when we did our assessment, we found that communities trust us. And I'm looking at what Reverend Carter did, being in the community, having this as access, having the same people there so that the communities can trust what you're doing. And so we thought if we had our own mobile unit that we could take during the week, plant them in these high ethnic group areas, communities, then we could be more effectual. And so we're in the process of getting that done. Our goal originally had been, over the 6-month period of the grant, was to get 600 shots in the arms. We've already accomplished that goal. So we've recalibrated, and now our goal is an additional 1,000 shots in the arm. And especially with our youth 12 to 17 that's eligible for that. Next slide. We developed our strategies, created more partnerships. Stacy Knowles, she helped us to get a partnership with Robert Brogdon GMC cards. The grant that we have doesn't allow for incentives, but you have to understand incentives do work. We had one family in Topeka that came, and there were 6 of them in the family. 4 of them were eligible for their vaccinations. And so they were given the gift cards that were donated to us by Robert Brogdon GMC. And the mother said, you don't know, we're going to be able to pay our electricity with these gift cards. And it just went to my heart. And so incentives, they may sound like they're just trying to pay off people to do it, but there are some actual families, especially in our low income areas, that need those. Our flyers, we try to do some different things, and we worked with KDHE at the state fair. We passed out their flyer. We attached candy to it. And if they wanted the candy, they had to take the flyer. So we thought that worked out very well. Our hand sanitizers have our logo on it because we also want to be able to provide rides, et cetera, help make appointments and do some different things like that. Next slide. So these are some of the events that we worked. These are some of our brochures. This is how we're documenting where we're going. You'll see that there's a Zoom meeting on there, and I kind of took a slide, but they knew that I did because I asked permission. Because we're even doing Zoom meetings with different organizations and making them aware of the correct information. There's so much misinformation out there that it just absolutely astounds me. But we want to make sure the correct information is out there. And so these are some of the things that we've provided. We also make sure that we put our information out there on social media. WIBW came out the day of our event on September 25th, and they did the cutest little news segment. And when the young anchor was out there, she was so impressed with what we were doing, she went live and was encouraging people to come and attend our event. So next slide. Challenges and solutions. We did have to do some de-escalation at one event. We had people that were coming around our booth that had Confederate flags on their shirts, and they kept walking back and forth and kind of, were trying to passively let people know that they were against what we were doing and everything. And we did not want it to get to a huge deal. And so we felt at that moment that we needed to just tear down our booth and just go ahead and leave for the day. And so we've had to, we have started, we were sending staff out in twos, trying to cover more area, but we think it's more safety in numbers. And so we had to do that. We also needed to increase our appointments and rides, and coordinating those. And so we increased our office hours from 8 to 9 p.m. Monday through Friday. And then we have someone on our phone banks, and then 9 a.m. to 8 p.m. on Saturdays, trying to cover those people that have second shifts, and doing some things like that. Oh, I have to tell you, we are going to take our mobile unit down to the meat packing plants and have them available before second shift, so that those that are going into second shift, if they want to go ahead and get vaccinated because they've slept through their appointments, then we're available. We're going to come to them. October is our final month for farmers market, and that's where we really wanted to have our mobile unit, but we'll be able to do some things because we're going to continue. Next slide. So I want to thank especially my KBFA Community Outreach Health Awareness Support staff. Kansas Beats the Virus, that came through at a moment when I was really kind of stressing about funds. Dr. Garcia, if I send her an email, it doesn't matter what time, I get a response. She gets people on it. And I just truly appreciate everything that she has done. And that means including me in on this group also. Miss Stacy Knowles, Clea, they're trying to get us, help to get us enrolled and certified, and the immunization enrollment staff. I want to thank you. Those are some of our sponsors down there that we have on there. And I want you to know that I think we've been effective in looking at our ethnic minority groups. Thank you.
Thank you, Dr. Holmes, for that wonderful presentation. Folks, if you wouldn't mind using the chat for any questions, we're going to have Dr. Smith start her presentation, and we'll have maybe just a few minutes for Q&A for both of them after. Dr. Smith?
Hey, greetings, everyone. So I am Charla Smith. I am in the Department of Population Health and Obstetrics and Gynecology, and I'm here today to talk to you about an initiative that was started to really combat disparities. So the Kansas Birth Equity Network was started about a year ago to combat disparities in maternal, paternal, and infant health. Next slide, please. So we prioritize Black women, men, and children, and this is the reason why. In the state of Kansas, for over 20 years, Black infants have been dying at 2 to 3 times that of white infants. And now Black mothers are dying at 2 to 3 times that of white mothers from childbirth-related issues. So we prioritize the entire family and focus on health equity of that entire family. As for COVID-19, pregnant women, specifically Black pregnant women, are least likely to get vaccinated. And what we saw in the data is that infected patients were 40% more likely to deliver prematurely and were admitted to the hospital intensive care unit at 6 times a higher rate than non-infected patients. So it is very important that we begin to focus on our birthing persons as it relates to the COVID pandemic. The reason that we focus on them is because the story is really not about social determinants of health. It's really about race. If you look at the disparities in maternal health, it really doesn't focus on being of a different socioeconomic status. It really focuses on being Black. So Black mothers who are college educated fare worse than women of all races who have never finished school. And when we look at the outcomes, we can see that the wealthiest Black women still do worse than the poorest white, Asian women and Hispanic women. And we also see that Black women who initiate care in the first trimester still have higher rates of infant mortality than non-Hispanic white women who never received care. So thus we have to focus on this because we are not seeing the social determinants of health in this reality. Next slide. So who are we? We are an organization that started with developing a community initiative where we brought together the Divine Nine in Wichita, Kansas, to really focus on infant mortality. And so these organizations are Black fraternities and sororities who send a representative to a monthly meeting and also participates in an annual event that they have hosted over 5 years. And these individuals are called the Kansas Sisters and Brothers for Healthy Infants. It's modeled after Sisters United that was developed in Arkansas, but we saw a opportunity to involve fathers in this and also to involve all birthing persons because families are quite different these days. And also we have the Kansas Birth Equity Network, which brings together about 44 diverse stakeholders in the state of Kansas to create solutions to reduce maternal and neonatal mortality. And why do we do this? And why is it that we have developed all of this? It's because we believe in birth equity, which is also health equity, because birth equity shifts the blame from women for poor health outcomes to system accountability for policies and programs. Next slide. So what we're doing in providing resources is that we are increasing knowledge. We are increasing knowledge by providing a training that creates readiness. And so we have developed a birth equity training that really does look at community engagement. It looks at birth equity. It looks at health equity. It also includes the social determinants of health because we understand that they are a factor, but we just don't see them as evident in our work. And then we also talk about bias and racism and postpartum care. And this knowledge then allows us together to have action. And we have monthly virtual KBIN meetings. So we are being very intentional about our work. Next slide. And how did we start this work? We started this work just like everything else that has started in this nation, was to listen, because what we heard from our mothers is that no one was listening. And there was this fear of not being heard, whether it was healthcare, it was resources in the community, or it was your family. And so we started by collecting maternal voices on COVID-19. Next slide. And so in doing that, we also provide an annual event that is hosted by the Divine Nine. And this annual event really focuses on those health disparities that are very present at that time. So this past year, it focused on COVID-19 and pregnancy. And throughout that event, we were able to provide a community resource power hour, a box, which included masks and other PPE information, as well as some incentives for our members and the community. And then we also had COVID-19 panels. The first one was physicians that discussed COVID-19 and what it meant to the health community and their reality every day in providing care for birthing persons. And the next one was a birthing persons panel, which talked about parenting and COVID-19. And then there was a fatherhood panel that talked about fatherhood and COVID-19. And so really to create this awareness around how this pandemic is affecting Black families and what we can do to improve their health during this time. And then we end that with a community birthday party and the last day with a birth justice walk. And we also had our first Black baby photo contest this year. And that is the picture you see here is the winner. And the reality is we really want to increase awareness and education in our communities, but we also want to highlight the strengths in our communities. And we want to just basically increase those strengths by providing the resources, awareness, and knowledge needed. But we also want to celebrate our community. So that is the reality of this work. Next slide. We're also doing a community blog, and this helps to increase awareness and education in our communities. And so we have released one blog on COVID-19 and pregnancy, and I'll talk a little bit about that data, what we found in our Collecting Voices later. But we're also working on a collective of blogs with our community. And so for our community engagement, one of our organizations that we partner with will be writing a blog on birth equity and parenting. The other will be writing a blog on defining birth equity. We will write a blog on the terminology. And then we have another community member who is writing a blog on engaging diverse stakeholders to create birth equity. And this is just increasing the awareness around the work that we do, but also solidifying that collaboration and having a product of that collaboration in our community. Next slide. We also started a podcast, and in that podcast, it is really the opportunity to have a safe space. So having a place where we're able to have conversations about women's health. And this podcast will be different. It is not an interview with someone. It's not an interview with a parent. It is really very vulnerable and transparent conversations about the things that birthing persons are facing in our community and how they can receive help and what action they can take. So these are really about true stories and conversations. Next slide. And what we learned out of all of our community engagement work was that the Black-led Greek organizations, which is our Divine Nine and the Kansas Sisters and Brothers for Healthy Infants, are uniquely suited to address these disparities. We also learned that true community engagement includes reciprocity, which means we engage them in our work, but we also engage in their work. We also learned that there is a need to highlight the strengths of the Black community. So often we go into the Black communities and we feel we need to teach them something. We need to help them do something, but we less often focus on the strengths of those communities and how we can contribute to those strengths to improve their health. And then we also learned that services and resources without education awareness and access are non-existent. So you can see that a lot of our work focuses on increasing awareness, increasing education, so that they can be aware of those services and resources that are available and they can actually access them. We also learned the importance of meeting people where they are, and that is creating those safe spaces for parents to discuss their concerns and also organizations need more interactions with parents. So as a part of KBIN, we have parent meetings, and the parents do not come and have questions from us. They really come and talk about their day-to-day. So often we'll hear conversations about the fear of taking your child to daycare in a pandemic. the fear of picking your child up when they're sick in a pandemic, or the stress that comes along with having to receive the call to pick your child up from school in a pandemic. So there's often discussions around that. Yes, we do include information about COVID-19 and how to get vaccinated, how to get tested, but the reality is we really want to hear from them, and we really want to contribute to the strengths in the work that they're already doing in their families. Next slide. What we've learned from our SPHI members, and that is the Divine Nine, we've learned that they so often hear from our communities, they so often get involved in our interventions and our programs, but then after the funding leaves, they're left to fend for themselves. We also learned that they want to continue the work of educating people, filling in the gaps of care, and getting as many people involved as possible. They also want us to create safe spaces because they want places where it is just focused on their communities and how to improve the health of their families. And so it's very important to us that as we move forward, that we really listen to these lessons and continue our work. Next slide. What we learned from our COVID work was that individuals, the moms that completed that, really wanted to know more about how we were going to acknowledge these historical factors and how they affect their community, that they wanted to be provided specific vaccine safety information that was focused on them as Black pregnant women. And they also wanted to have that information accessible to them. They wanted to know about these clinical trials. They wanted pamphlets and social media campaigns and open community discussions. And that is one of the reasons why we focused our Celebrate Day 366 activities, which is really focusing on the mom, dad, and baby making it to that 365 day. We focused that on COVID-19 because they said that they wanted to hear more information. They want these vaccine recommendations to come from their trusted healthcare providers because they're pregnant. And there are other concerns when you're pregnant and you have to take a vaccine, or you have COVID-19. And so that is an additional stress on the body. So they want that. They want that we ensure that there is mistrust, and this neglect and abuse that they're suffering in our healthcare system is not going to continue. So they want to hear that there's going to be we're going to work on building trust. We're going to work on removing this mistreatment in their healthcare and increasing the quality of care that they receive, as well as creating these safe spaces. So not just in their community, not just in these conversations, but when you receive care, you want to feel safe. Next slide, please. So how can we do more of this? Of course, with KBN, we have been really focused on engaging communities and creating solutions. We've not started initially to implement and disseminate that work in a different format, which is delivering programs to our community. So that is one way to continue this work, but we want to support the existing efforts to expand the reach, because we only have so many individuals that we can reach, but the organizations that we work with can reach additional organizations. And so the idea is that we begin to work with our organizations so that they are disseminating information, they are reaching the populations that they provide services and resources to, so that increases the reach. And then to amplify the work to be statewide. The goal is really that KBN will be focused on the entire state. And so all Black birthing persons will have access to this information and the resources that are provided. And then there is a need to adapt health equity and birth equity as a priority and utilize the network to address all disparities. Although we focus on birth equity, the reality is we're really focusing on the family structure. So we're really focusing on the health of the mom, the dad, the birthing person, and the child. So it's really that Black family structure. And until we address all of these disparities, we really have not achieved birth equity, because a healthy mom does not need to have COVID, right? And then to get involved with us and to partner with KBN, if you want to do more work around birth equity, to really look at how do we as a state really focus on improving the health of Black women, because when Black women thrive, we all thrive, right? And so we want to make sure that that focus is there. Next slide. So if you're looking for more information about KBN, the work that we do, or you want to get involved, you can use your phone to scan here to get involved. But here's some individuals that do this work that I want to thank for their contributions. My team is really the best team in the state that does this work. And so it's, of course, myself and Dr. Michelle Redmond in Wichita, Kansas. She is an Alpha Kappa Alpha. So she leads that work around the sororities and fraternities. And then there's Aloma Obi, who is the research assistant at our new GRA, Muhammad Islam. We also have our community engagement leadership team, and Joy Barnes is an AKA as well, and she leads the SPHI work in Wichita, Kansas. And then, of course, if you're going to do any work in Kansas and engage the community, you must have Broderick Crawford at the table. So we have recruited and sustained Broderick Crawford to help us with fatherhood engagement, which is one of the areas that we want to improve on, because we know that a healthy father and the father being in agreement and having the awareness and knowledge of how to keep the mother safe is very vital to the health of the Black family. And so we have engaged Broderick Crawford to do that. You can visit our website. You can use this link to join our network. You can contact me if you need more information. Thank you so much.
Thank you, Dr. Smith, and wholeheartedly agree about our friend Broderick. Thank you to both Dr. Holmes and Dr. Smith for these wonderful presentations. We are bumping up on time and we're anxious to make sure that we get to our discussion. So if you have questions for Dr. Holmes or Dr. Smith and want to put them in the chat for them to respond to, that would be greatly appreciated. With that, now we're going to kind of take some of the threads that I think Dr. Smith and Dr. Holmes did a great job of weaving into their presentations and use those as opportunities for discussion. We're really interested in having discussion about some of the sort of foundational aspects of equity. So we'll have breakout groups. There will be 4. One will be focused on COVID misinformation, another on implicit bias among healthcare workers. The third is social determinants of health, and the fourth is sustainable and diverse infrastructure. So with each of these, your facilitators have key questions, but we would like to just make sure that we do sort of use some of the time to bridge to what ideas are raised up within the context of our conversation and how that can be used to push forward potential PAVE or increase the REACH projects. And as just a reminder, you see on the slide, these 2 opportunities are ongoing and really provide an opportunity for community-driven or COVET member-driven projects that really would help us amplify some of the work that's happening. We do, all of your facilitators have these. If it would be helpful during the breakout groups to look at this information, they can show you. But with that, I will invite Rena to move us into our breakout groups. Many of you completed a survey and we've assigned you based on your survey response. If you didn't complete the survey, you're going to kind of be randomly assigned, and we hope that that works out for everybody. Rena, if you could assign us and plan to bring us back at 12:55, that would be great.
Perfect, sounds good. And I want to let everybody know, I'll open these up and everyone will get prompts on their screen. If you don't get a prompt, you are in room 1, health misinformation, and you'll stay here in the main room. So, all right, your rooms are open.
We'll give everyone a minute here just to make sure they're in the right group or they have accepted their breakout room groups. Looks like we should be good. So hi, everyone. So good to see you all today virtually. My name is Tatiana Darby, and I'll just be helping to kind of co-facilitate our time in this great breakout group today. And we're really going to be focusing on a topic around health misinformation, specifically thinking about COVID and how we can kind of continue to engage communities of color via media. And so if it's helpful, I am going to share my screen here so you guys can take a look. Let's see. PowerPoint. Let me know with a thumbs up if you can see the screen here. Perfect. So we're going to be thinking again along the lines of health misinformation, really focusing on initiatives that help us kind of address health literacy and improve communities and their abilities to really find, digest, use, and disseminate information to inform on health-related decisions. So to kind of begin, I'm going to be doing a little bit of note taking, but I'd love to hear from a few of you, just historically speaking, what media outlets are out there that we've seen historically exclude communities of color, and in what ways, whether intentionally, unintentionally, have we kind of seen this come into play, especially thinking about COVID and, these past 2 years, COVID response, equity, and vaccination, and that sort of area.
Well, as most of you know, and as you probably heard, I'm not shy. So here we go. I will say that any mainstream, so I'm in Kansas City, specifically in Wyandotte County, and all of our local news, whether it's print or video, is not geared toward any minority community. And in our case, in Wyandotte County, we get even less than that. So because we're near Kansas City, Kansas, and Kansas City, Missouri, most of the news comes out of Kansas City, Missouri. And so we in Wyandotte County have to fight to get positive news. Now, if there's something that happens negative, oh, you best believe they're going to broadcast that. But when it comes to anything positive, the great work that's happening in our faith communities, the great work that's happening in our health department, they get very little press. And so it becomes a challenge, even with that now, to then look at how people of color then get information. Certainly we have the Call and the Globe and, a couple of other publications, but they don't get the press. And I know, Dr. Garcia, you're waiting on me to get you a list of all of these publications. I can see it in your face. But yeah, there are a couple of Black newspapers that have been here, for some time. But again, outside of, I would say, a certain generation, I know, for example, my sons who are 24 and 25, they don't read the Call. They don't problem. I'd be surprised if they even knew that it existed. And so there's a generation that has been lost as it relates to Black print media. And I'll stop there.
And I guess I would like to say that, from a kind of national level, when we think about just all social media platforms, you have Black Twitter, or, you have Black TikTok. So to me, that says that there's a sector that is trying to appeal to African Americans or people of color. And if you're not getting your information from there, where are you getting it? And so there's not an official Black Twitter, an official Black TikTok or Instagram, but that platform or that sort of subsector has been created to speak to our young generation. And how do we get information on those platforms, good information? And so I think there is a lot of bias and lack of diversity when it comes to, marketing on social media. But I think we have an opportunity and, quite frankly, a responsibility to put or use our platforms and to put good information out there, because they're reading a lot of misinformation. I'm hearing it on a regular basis, things that just aren't, quite frankly, true, but they're turning to those platforms to get the information. And so how do we make sure that for every, 2 or 3 bad posts or misinformation, can we get at least one, post or accurate information?
Yeah, thank you both so much for your insights there. I absolutely agree. This thought of, what's being shared when it comes to, as Broderick mentioned, good versus bad news. When you see negative news, it travels quick, and it has the ability to impact and influence people's, health-related decisions in really prominent ways. And again, thinking about social media and how much information can just be found with the click of a button, but trying to decipher, what are the sources behind this information? Where is it coming from? Who has access to it? Who is it for? And so on and so forth. It becomes really hard to think about, how do we engage communities in a meaningful and impactful way that's going to lead to, really productive decision-making around health-related issues, specifically around COVID. And so piggybacking off of that, what community organizations, would really benefit moving forward from whether it be PAVE or ITR funding? How can we uplift and raise up those outlets, as you mentioned, whether it be, Black newspapers, Black Twitter, right? Social media. How can we look towards raising up voices and communication platforms that are really going to help us disseminate information in a positive and productive way? What type of information, can we equip media outlets with, and how can we empower them to disseminate that information?
So I'd say we've got to be intentional. Through some of the work that we're doing that both Pastor Carter and Nicole are aware of with our Health Equity Task Force, we have specifically reached out to Latinx or Latino radio and also African-American radio. So we've got personalities from both sectors that now regularly participate with our communication teams. And so they themselves then, for example, with La Mega Radio, we've got folks that will regularly do free PSAs. Likewise with Darren Story and 107.3, they'll regularly do free PSAs. But we had to reach out to them, and once they came on board, in both cases, they're willing to come out to do spots. So there's a willingness to put the information out. We just haven't been very good at being intentional of getting information to them. So I think intentionality is the key, and then financial support, because a lot of times our African-American and Latino radio stations don't have the funding that some of the other radio stations do. So for them, advertising is huge, whereas others can do some things for free and it doesn't really hit their bottom line. So that's another piece that we've got to consider about our minority radio stations. And then finally, I'll say is, where are our local personalities, whether that's our sports personalities, we've got the Chiefs, the Royals, the Sporting KC, where are our players? Where do they weigh in? And I know that there's some restraints because of, who they are and where they are, but people can do what they want to do. And so where are our sports personalities, and even TV personalities? I mean, we've got several folks from this area that are actors and musicians, et cetera. Where are they weighing in? For example, I know several. I've worked for a lot of years in HIV. We've got several that will come here to support HIV. We've got several that are breast cancer, prostate cancer survivors. They are very vocal, but where are they when it comes to COVID?
Roderick, I agree. I think we've got to continue to be intentional. One of the things that I've taken on personally is, as a pastor, as a member of the Baptist Ministers Union, I share with the pastors that it's going to be important for them to be aware and to expose themselves to persons who can help them get the right information out there. We, for instance, need to know how to navigate the information that you get on Facebook. I've had many conversations with members of the church who take some of the stuff that they hear on Facebook that's absolutely ludicrous, but they take it as if it's real. And when you talk to them about trying to find out where this information is coming from and whether or not this information is real, they have no clue. They just accept it because it's on there. So pastors and others of us have to remind them that we have some responsibility to check. And I don't think we do that enough. To me, that's a part of being intentional. You have to do the research. Somebody showed me a video that supposedly came from CNN that talked about how you become magnetic. And I said, then I've been vaccinated. go get your magnet and put it on here. I said, y'all have gotta, I don't know. Some of the stuff we deal with is you would think we would be better equipped to negate that, but it doesn't always happen. So.
And I just want to add one thing to that about being intentional. I think we are missing the mark on our messaging and not acknowledging why people are looking at social media instead of relevant, places, and so if we can craft messages to address the hesitancy, to address why, to address the mistrust of healthcare, to address, why you don't want to get vaccinated and why it's important, I think there's a way to craft it to acknowledge, a person's hesitancy or the fact that I'm going to Black Twitter and other places and not to, credible sources, if you will.
Mm-hmm. Saw that Jonella had her hand up.
I just wanted to quickly say that it's good for us to focus on what isn't working, but if we could also turn that around and work on things that are working. WIBW has been a good friend. And so how do we get on their shows? How do we get on the morning shows? How do we get out and do that? And then we're talking, there's also Blacks in Western Kansas and Southern Kansas, so how do we do that? How does the governor's office lend credibility to this group? By bringing the governor in, have her buy me lunch, since I'll drive in, and we do the photo op. We get that out there and they show that we have the support of the governor. She's supporting what messages we're putting out there. So
I think she would be very interested in that. And I'm very interested in trying to nurture the relationships that we need to get this message out there. So I'm very open and very happy for that discussion.
And I can give you one example. We had an event at St. Peter and H Street where the governor came. It was a vaccine event between multiple churches. And guess what? When she showed up, you knew she was going to be there because the media was there before she was there. Mm-hmm. We had to make room for her because they were all trying to get in front of her.
All right, thank you. I think we're all back from breakouts. It seems as though group one, at least, their hearty discussion was still going. And I know my group also had some good discussion. I'm gonna ask that we do really fast debriefs of each group discussion. So if you are the designated person, I'm gonna keep you to about 45 seconds. So just do keep that in mind. If we could start with a debrief from group one, that would be helpful.
Yeah, we didn't get a chance to pick. We were deep in our conversation still, so we didn't get a chance to pick who was going to report out. But if there's someone really quickly who would like to do it, otherwise I'm happy to do it. So I'll give like 5 seconds and then I'll jump.
It's you, Tatiana, go.
Okay, I'll jump in. So really, I think some of the kind of key conversations that came out of our discussion revolved around one word in particular, which was intentionality, and really thinking about, collaborating and partnering with strategic communications outlets and media sources, because there are some that are out there that are willing to disseminate productive news around vaccine equity, especially among communities of color. But it's just a matter of, are we in the right rooms with the right people, collaborating in the right ways and in very thoughtful and intentional ways to make sure that misinformation is cleared up and communities of color have access to decision-making, productive decision-making around health-related issues.
Thank you, Tatiana. Sounds like a great discussion. Group two, implicit bias.
Hello, everyone. Unless anyone from my group would like to jump in and summarize, I'm going to just plow ahead. All right, our discussion revolved kind of around this question of like, is it individual or system? And with trainings, we're focused on the individual. And we talked about the way that you can advocate for your own family members going into these healthcare situations. But in addition to that, just knowing that trainings don't last forever, they have to be re-upped. And that focusing on the way that individual people are interacting through implicit bias training and cultural competency training, they don't, it doesn't always address explicit bias, which is also something that affects folks. And sort of expanding the question, talking about the limited amount of time that physicians and healthcare workers have and whether adding another training is really going to help, and assuring that these people are not overworked so that if the training is going, if they would like the training, they can actually take it, and changing the population of healthcare workers and Black and African-American physicians, like increasing the number of people going to medical schools.
Great,
and,
thank you,
and
Sarah.
graduating. And yeah, all right.
I think that's a good debrief. Thank you. Sarah Landry, your group.
Yep, it's me. I'm going to share
Oh,
out.
sorry.
So the thing that we focused on was what we'll call like a hidden population, an invisible population. Those are people who are homebound or maybe socially isolated, and making sure that they actually have the vaccines available to them, that's a structural barrier, that it's a statewide problem, but there really is no statewide way to address getting vaccines to these people. And additionally, they may be homebound. That does not mean that there are not people coming into their homes who might not be vaccinated. So if it's healthcare workers, who we talked about are most often not necessarily registered nurses, or maybe they're having groceries delivered, or maybe they're having family visit them, but to make sure that people have the opportunity to get vaccinated if they're homebound. So in a nutshell.
Thank you, Stacey. Thank you. I appreciate that. I'll go for the last group really briefly. And thank you everybody for just staying an extra 2 minutes. Our group started off just really debriefing on the presentations, and really started off talking about the anger that we felt about the blatant racism that had been experienced by our people doing really good work in communities, and that the onus had been on them to de-escalate a situation that they didn't create, and that they were working to create healthy communities. And what can we do about that? And I think we felt a little bit at a loss for solutions, but really hope the group, if anybody has solutions that would be raised up, there was really big interest in that. Also, we kind of talked about the systemic things that support the lack of trust, and centered around a question of how can we do better. We were talking about how do we get shots into homes, I think connecting to what Stacey's group was talking about, and recognizing that transportation is an ongoing barrier, and that really some of this is also just strengthening the population health strategies and reinforcing public health as a respected force in this work and having a lot to contribute. We will have fuller notes of the discussion in the notes for the session, and I'll hand it back to Dr. Garcia to close us out.
Hi, everyone. I am cognizant of keeping you over 2 minutes. I don't like to do that, but I want to thank everybody so much. I felt like my group, it was just wonderful to be part of that conversation. I'd really like to take mine further and meet with this group again and figure out how to make some of those things happen. So anyway, thank you everybody for joining. We will send out the notes and see you in November.